I'd like to introduce Delores from the United States, who takes LDN for multiple sclerosis. Thank you for joining me, Delores.
Thank you.
Could you tell me when you first started to notice your MS symptoms?
I would say I had a procedure, an EVLT, which is an endoscopic vein laser therapy to help with varicose veins that I have. And right after I had that procedure, I developed really bad foot drop, and I was tripping over my feet. I wasn't able to run any longer, and it really impacted my life. So that was a year and a half ago. And you know, on my roller coaster ride, medical roller coaster ride of trying to see a neurologist and, you know, letting my internist know that I must see a neurologist because I have foot drop, which obviously is indicative of something neurological. It just took over a year to finally get to a neurologist and be worked up with the MRI and everything else and x-rays and what have you. And I was diagnosed with multiple sclerosis, which I have lesions on my head, on my cervical spine, on my thoracic spine, and that it just was a big shock considering I'm 40 and I've always been very health conscious, ate healthy, no drinking, no smoking, and it was just a oh my God moment to have that diagnosis. I obviously knew something was wrong, but to actually get the concrete diagnosis was pretty difficult. I have vision issues with the multiple sclerosis that my initial problem was probably 5 years ago, but my eyesight came back completely at that time, and probably now within the last 6 months the vision problem is back again. The low dose naltrexone I initially heard and found out about through reading Julia Sopchak's book, what was
Honest Medicine.
Honest Medicine, yes. So that was my, initial introduction to this medication and knowing about it. And obviously, I got onto a website, onto the Facebook, and spoke to other people that have used low dose naltrexone for other problems. And many people that are on that website also have, multiple sclerosis. So it was just a good sounding board to talk to people. And personally, I, considering that MS is considered an idiopathic disease that, the regular medical foundation doesn't even know what it's from, I personally take a lot more stock in listening to anecdotal evidence from people that actually use the medication. So I'd have to say that it's been helpful in, making me feel a little bit stronger and able to walk. It's kind of difficult to really assess with, just being fairly new to this MS thing, and it really is just an odd disease because it comes and goes as it does. But
how long was it after you were diagnosed before you heard about LDN?
Oh, within probably a month and a half.
And how easy was it to obtain a prescription?
It was very difficult, extremely difficult, and I had many doctors. I have a vascular surgeon. I have a psychiatrist. I have a general practitioner. Let's see, how many different doctors do I work as, or I did work as a registered nurse for 16 years at a hospital that is, I've gotten to know and who educate physicians and nursing students and other professions as well. So I do know plenty of people that, I would think, oh, maybe you can help me out here.
Mm-hmm.
But no, something about, I don't know if it's considered, because it's considered an opiate antagonist. They hear the word opiate and they say, oh no, we're not prescribing that. I mean, it's kind of funny because it's like, did you hear? It's opiate antagonist. It means that it counteracts, an opiate medication. So it's kind of difficult when you're talking to medical professionals that don't truly understand the information when it's, when they get it from, I don't know, they make it out like they're getting the information from left field. But I know they study medication in school, so I don't understand why it was so difficult to obtain a prescription. However it was, I ended up going to a holistic doctor, and he gave me the prescription.
And when you first started, did you notice any introductory side effects?
Yes, I did. Initially, I started with 2 mils, which would be 2 milligrams, because I made it a 1-to-1 ratio in order to, change while I was figuring out what dosage in order to get up to the 4.5. So I had the liquid formula of a 1-to-1 ratio. And initially I used 2 milligrams. And I would say, and I stayed at 2 milligrams for probably, and I was okay at 2 milligrams for a couple of weeks. And I was fine with that. But then I tried to boost up to 3 milligrams, and I developed a headache. And the headache, I had to go back down to 2 milligrams. So it was just, being aware of what was going on with my body. And I was fine at 2 milligrams. And then I just slowly worked up to the 4.5 milligrams, which is where I'm at now. And I've been taking the medication for over 3 months now. And I'm fine at 4.5 milligrams.
So what has LDN done to help you?
What has it done to help me? I would have to say that I think that it has improved my bladder functions, which, if you're familiar with the multiple sclerosis, it affects both your bladder, and it can have effects on your bladder and your GI tract. So it's difficult to have control over stopping. If you have to go to the bathroom, you have to go immediately. There's no waiting a couple of minutes. It's immediately. And I'd have to say, with taking the low dose naltrexone, I have more control over that. It's not like all of a sudden I'm thinking I have to go and poof, I'm, emptying my bladder. So that is quite an important thing for a 40-year-old woman, I'd have to say.
Did it help with fatigue? Was that a problem?
No, I've never had massive fatigue. I mean, I'd have to say that it definitely, I've never had really bad fatigue.
Mm-hmm.
And so I never had that problem.
What would you say about your eyesight?
My eyesight, my eyesight right now, it's not bad. Like I can see pretty good, but I still have, I can't walk very quickly because then my eyesight dims down a little bit.
Mm-hmm.
So it's not, I can still see. However, if I walk a little too quickly, my eyes dim down just a little bit. And it's not, it just is how clear you're able to actually see. It's not that I can see just fine. I know when something's in front of me, but
Mm-hmm.
it's not, I've always had perfect vision. So to go from perfect vision to not having clear, perfect vision is just one of those things. But I'd have to say that it's still there. I mean, it hasn't helped in that
Mm-hmm.
regard. I mean, obviously,
It's still very early days for you,
Yeah.
though, isn't it? I mean, personally, I continued improving on LDN for about 18 months.
Uh-huh.
So it will
That's
be
hopeful.
interesting.
That's
Exactly.
very hopeful to me, and you know what? There's nothing wrong with having a little hope. So I'm hoping that it will just continue to, you know, do just that and help with the many issues that I have. So
What would you say to other people who are contemplating trying LDN?
I would actually feel that, you know, depending on what their circumstances are, and probably the biggest thing, like I have a healthy system, and obviously people coming in, you want to know like their whole overall, you know, bodily functions, physiology. I feel pretty comfortable with that. But I look at like the one thing about a very high dose of naltrexone, they focus in on the liver functions and stating, you know, that it can cause liver problems. And that's at a very high dose. And of course, these are people that at the higher doses had physical addictions. So is their liver problems because of their physical addictions, or was it the high dose of the naltrexone? I think it's pretty difficult for them to be able to say one way or the other, considering in that way, I don't think that the medication had actually been looked at specifically in that at that juncture.
Originally, though, in trials of naltrexone back in the 70s, LDN, naltrexone was only found harmful to the liver in doses of 300 milligrams a day.
Yes, at very, very high dosage.
Mm-hmm.
But I'm just saying, like, if they want to look at something to be worried about, that would probably be my biggest worry. However, I think that, again, you're taking it at a much lower level.
Mm-hmm.
So it's probably not, it's not going to have the same effect as taking 300 milligrams.
Okay.
And even then, I think it's difficult for them to really have the knowledge to know if it was actually the medication or if it's from other addictive medications that they had ingested.
Mm-hmm.
As far as, I think that it's very low possibility that it can have any negative effects on a person.
Mm-hmm.
But again, it's important for each individual to be aware of how their body is actually responding I mean, it was cleared as far as when I developed the headache. It was very clear that it occurred when I was taking that medication, and because I responded to it pretty quickly, it resolved itself quickly, and I was able to adjust to from the higher rate to the lower rate, and then back up to the higher rate after, and with no problems. So I feel very comfortable actually suggesting this as a possibility for people, and as long as each individual listens to their body at each juncture, even if it's just a headache, or I mean, they need to really listen to their bodies and be aware.
Thank you very much for sharing your experience with us, and I look forward to hearing how you progress in the months to come.